Okay, this video is a memorial tribute to Dr. Gregory Sloop. He was a pathologist. He was a genius. He is the pioneer of the atherothrombosis theory of atherosclerosis. He deserves a Nobel Prize, but they'll never give it to him. The greatest doctors are not allowed to be put into the textbooks, in case you didn't know that. He figured out the mechanism of atherosclerosis. That's very important. It's the most common cause of death, okay? And it also causes cancer and all kinds of other problems. His book is at the Amazon, for example, and they've dramatically increased the price. The price is $157. It's not that big of a book. I have a copy right next to me. It's only about 135 pages. So why would it cost $157? What I'm trying to tell you is this is called a paywall. You know, corporations who see the book as a competition to their product, they will make a deal with the publisher to raise the price of the book so a regular person can't buy it. They also do that with research papers to make it harder for people to see them. Because once you understand his theory, there's a lot of implications from it that teach you how to be healthy. Okay, so $157, it's a paywall, that's what it is, just like there's paywalls to papers. Okay, the next thing is I'll let you know that I was friends with him, kind of academic friends. I just talked to him once every 6 months or so. And I wrote a book, he wrote a book review for me at Amazon, and he had to submit it several times, 3 times before they finally would publish it. And the impression I get is, that's another example of, they try to hide, my knowledge from the public, okay? That's my impression. Not that I know what happened. I do not know what happened. But I can just tell you, when I search around for the people who tell the truth, it's a lot harder to find their books and their papers and their videos than it is the people who are BSing you. So with that in mind, we'll continue about Dr. Sloop. Sloop, he's a pathologist. He did plenty of autopsies, and he noticed, well, gee, more and more people are dying from coronary artery disease. You hardly anybody died from coronary artery disease back before World War I. But since then, the curve is very rapidly going up at, like more than 45-degree angles. Okay, so Sloop wanted to figure out why. He wrote this masterpiece paper, landmark paper, called The Unifying Theory of Atherogenesis. This paper also, you have to purchase the PDF. Again, it is hidden behind a paywall. And this is the best explanation that anybody has ever written of atherosclerosis. And the key point is that it's a blood clot, and then he figures out why does the blood clot, okay? Here's just some other papers of his. Here's a paper, another is atherothrombosis is a thrombotic, not an inflammatory disease. Here's another paper of his, hormonal control of blood viscosity. Well, I'm going to get you into the pictures in just one sec, but I just want you to see some of his papers. The role of blood viscosity in infectious disease. Okay, and now here's a key point. This is something you need to know. You can even take a picture of this. This is from a lecture he gave. If you go to the Viscosity channel, you can see some lectures by Dr. Sloop at the Viscosity channel. Okay, he's showing that atherosclerosis is actually a blood clot. It's like an organized hematoma on the side wall of an artery. And some indications of that, it'll often have a laminar shape, almost like the rings on a tree as it grows and shrinks. It'll also have blood vessels inside of it, like renal-canalized blood vessels, part of the immune response to remove the hematoma. And they'll gradually convert it into fibrous tissue, into scar tissue. Okay, but that's a very important point. Atherosclerosis is a blood clot. You need to know that. Doctors don't know that. I talk to tons and tons of doctors. Not a single one ever knows that because it's not in any of the books. Okay, and then just to say, so you're probably wondering, well, is Dr. Sloop, is he out on a limb? How does he know it's a blood clot? Because he's a pathologist. He looks at it under a microscope and he says, gee, this looks the same as a blood clot. And I can tell you, I've looked at many, many thousands and thousands of atherosclerotic plaques on CAT scan, CT angiography, for example. It looks the same as a blood clot because it is. You can't tell them apart because they're the same thing. Okay, here's Dr. Karl von Rokitansky. He's a very famous pathologist from the late 1800s. He looked at atherosclerosis under a microscope and he said, you know what? This looks like a blood clot, okay? So this has actually been known for a long time. Here's another very famous pathologist. This is the most famous cardiac pathologist in the world, Dr. William Roberts. He looked at atherosclerosis under a microscope and he says, you know what? This is a blood clot, okay? So he knows it. Everybody knows it, but Sloop's the one who figured out how to make sense of it. Because if you read all the standard textbooks, pathology books, and the other papers on atherosclerosis, they run you around in circles with minutiae and they can never make sense of things. Okay, he makes sense of it. First of all, you start out with the windkessel effect. Normally when the left ventricle contracts, it pushes blood forcibly into the ascending thoracic aorta, which then stretches outward. And that's systole, means contraction, like in Greek. Diastole means relaxation. So when the left ventricle relaxes, then the elastic fibers in the ascending thoracic aorta, they recoil inward from their elasticity. And that propels the blood during diastole. You can't replace these elastic fibers after 20 years of age when you hit, physical maturity. And so what happens is, if you chronically overstretch these fibers due to hypertension from eating high-fat, high-sodium diets, you'll overstretch these fibers and they will progressively lose their atherosclerotic recall. That's why the older people get, the more they have systolic hypertension and not diastolic hypertension, because they've trashed all their elastic fibers and they can't be replaced. When you can't replace your elastic fibers, then systolic pressure has to go up in order to compensate for the loss of diastolic flow. What that means is you get a higher systolic blood pressure. Okay, I'll show you an example of that. Here is a normal blood pressure. Let's say something like about 110/70, okay? Now, with hypertension, you might have a very high systolic, something like 200 systolic over a 100 diastolic. But you'll notice there's a wider pulse pressure. Pulse pressure is the difference between the top number and the bottom number. Okay, so for normal blood pressure, let's say your pulse pressure is about 40. With this hypertensive patient, you got a pulse pressure of about 100. Okay, but the key point is the systolic is higher. The higher the systolic blood pressure, the faster the blood velocity. When blood velocity gets excessively fast, it damages the arterial wall. It also creates a lot of turbulent flow and backwards flow from bouncing off of things. That's called retrograde flow, also eddy currents. We'll get into that in just a moment because that ends up being clinically important. The other thing Sloop figured out was that all these red blood cells have a zeta potential, meaning a negative charge on their outer surface, and that's a very big deal. Two red blood cells with a negative charge on their outer surface will repel each other, and that's a good thing, so they don't stick together. You don't want them randomly clotting. And guess what? All the white blood cells in the blood, they have a negative charge as well, so they don't stick together and clot. And the lining of the artery, the endothelial cells, it has a negative charge, so it doesn't stick to the blood cells and cause clotting. Okay? Even the most common blood plasma protein, albumin, has a negative charge, a zeta potential, so they don't stick together and clot. Now, if you have a molecule with a positive charge on its outer surface that's a big enough size, it can cause some red blood cells to stick together a bit. For example, IgM antibodies from acute phase infection, that can do it. IgG antibodies are too small, so by themselves they can't do it. But IgM, it can stick red blood cells together. That's why you have more increased risk of thrombosis with an acute infection. That's one of the main reasons. Okay, then this is a slide from Dr. Sloop's lecture, one of his lectures at the Blood Viscosity channel, and he talks about bridging molecules. Bridging molecules are things that overcome the zeta potential and stick red blood cells together. So fibrinogen, the blood clotting protein, LDL cholesterol will do it. That's why LDL cholesterol is a risk factor for atherosclerosis, because it predisposes the blood to clotting. HDL prevents them from sticking together. That's why it has a therapeutic benefit. Uric acid also gets red blood cells to stick together, so it's also a bridging molecule, okay? And the LDLs are big enough in size and positively charged so they can do that. Okay, here is showing a red blood cell is normally about 7 microns in diameter, capillaries about 5 microns in diameter, and the red blood cells, because they're bigger in diameter than a capillary, they have to deform themselves a little bit to pass through the capillary. Now, if you've got bridging molecules like high LDL cholesterol sticking these red blood cells together, then you're going to have to pump harder to push these red blood cells through the arteries, through the capillaries, for example. And you can make it worse if you're eating dietary sodium, causing this to constrict down, narrow in diameter. Sodium is a vasoconstrictor, so is uric acid. That will also raise pressure. You need to pump at a higher pressure to pump through a constricted system, okay? The reason you have a blood pressure is to pump blood to the top of your head, your cerebral cortex. You got to pump against gravity, okay? That's why your pressure is what it is, because that's what it takes to get oxygen up to your brain. Now, if you're pumping normal blood, it's kind of like water. It doesn't take a lot of pressure to pump it. But if you're pumping thick blood, it's like a milkshake, and then you have to pump a lot harder. Okay, and then imagine your combination, like let's somebody eats a pizza. Okay, the pizza is full of fat, causing blood sludging. The chylomicrons also bridging molecules stick red blood cells together, and the LDL cholesterol. Plus, then the sodium from the pizza vasoconstricts the arteries. Now you're pumping thick blood through a constricted system. Pressure's got to go up a lot. Okay, and you throw some caffeine in there, that also raises your blood pressure more. Now you got three things simultaneously raising your blood pressure, okay? And then you're stressed out about something, you're sleep deprived. That'll also raise the same hormones, catecholamines and cortisol. All of that will push your blood pressure higher and higher. And then you got a big fat body, so you got to pump blood to a bigger amount of tissue. That'll also raise blood pressure. So you can see how all the negatives can add up quickly if you're eating that junk food crap. Okay, here is a graph of LDL cholesterol versus blood viscosity. Viscosity just means thickness. So the higher the LDL cholesterol, the higher the blood viscosity. And again, these are examples of bridging molecules, IgM, LDL, fibrinogen, uric acid, and they'll stick red blood cells together, okay? Normally red blood cells repel each other, but they can be stuck together, okay. Notice the opposite effects of LDL and HDL cholesterol on blood viscosity. So here's a graph from one of Dr. Sloop's papers. The higher the LDL cholesterol, the higher the blood viscosity, the more they stick together. The HDL has the opposite effect. It makes it stick together less. This is just an old graph from the work of Peter Quo, the cardiologist in Pennsylvania in the 1950s, who would feed patients a high-fat meal, and then he would check their blood lipids, every 30 minutes. And what he found was at peak lipemia, maximum blood lipids, they would get the most amount of cardiac angina, chest pain, from coronary artery narrowing, coronary artery stenosis. And he also found it was even worse with unsaturated fats. They cause even more blood sludging, but you don't get any of it. This green line that's, it stays at baseline, that's with a carbohydrate meal, a no-fat carbohydrate meal. And then, Ray Rosenman and Meyer Friedman also repeated this work in the 1960s, okay, in a slightly different way, and they were emphasizing the eyes, but Roy Swank did research this also on blood flow, our red blood cells sticking together. And he talked about when you eat a high-fat meal, the red blood cells stick together. There's a very nice movie at Dr. McDougall's YouTube channel called Dr. McDougall Health and Medical Center. It's only 50 seconds long. The name of the movie is called Blood Sludge, Blood Flow, Before and After Eating a Fatty Meal. It's only 50 seconds. I recommend strongly that you watch that movie. You'll never forget it the rest of your life. It'll teach you a big lesson about high-fat meals. You won't want to eat them. Okay, sialic acids are located at the end of the glycoproteins on the glycocalyx, the glycosaminoglycans, and they're basically like a glucose with a carboxylic acid attached to them. The point is they got a negative charge on them, and they contribute to the negative charge, the zeta potential of the outer surface of your white blood cells, your red blood cells, and your endothelial glycocalyx. Cholesterol sulfates also contribute to that. They have a negative charge on them. So when the red blood cell travels through a vessel, its negative charge is repelled by the negative charges of the glycocalyx. And that's exactly what you want, so stuff doesn't stick together. Everything has to flow independently. Okay, here is the sulfates. There's lots of sulfates on the glycocalyx. Tons and tons of negative charge. A negative charge, major barrier to unwanted clotting. Here's a plasma membrane of a red blood cell or of an endothelial cell, and you have the core proteins that stick up from it, and then they're attached to glycosaminoglycans like heparin sulfate, full of negative charges, and at the end of it you got a sialic acid. Sialic acid is like the identification card of a cell that it's self, so the immune system feels it like by braille and recognizes it belongs there, it is self. Okay, the water molecules have a dipole, and they have a positive charge on the hydrogens relative to the slightly negative charge, partial charge on the oxygen. So the water lines up with the glycocalyx and makes it slippery when wet, and that also helps the blood cells, like the red and the white blood cells, to travel through the capillaries. Despite their bigger size, they slide through. Again, you see the sulfates with a lot of negative charge on them. Dr. Sloop noted also that the higher the hematocrit, the more red blood cells a person has in their blood, the thicker their blood will be. And as a matter of fact, under normal conditions, it's the most important determinant of blood viscosity. So he does not think epoetin is a good idea. Like a lot of those bicycle riders for Tour de France died of heart attacks because their blood was too thick. And that extra hematocrit might help them when they're climbing up a big mountain in the Tour de France, but it doesn't help them when they're laying around at their apartment later on and they risk thrombosis in their coronaries. Okay. And also, this is why women live longer than men, because they menstruate and they lower their hematocrit. The higher the hematocrit, the higher the blood viscosity. Women, because they menstruate, premenopausal women almost never have a myocardial infarction. Their lower hematocrit from menstruation protects them. Also, when red blood cells first come out of the bone marrow, they're more flexible, more deformable. As the red blood cell gets older, the inner leaflet of the plasma membrane phospholipids, phosphatidylserine, start flipping more and more into the outer leaflet, and that causes stiffening, a loss of flexibility of the red blood cell. Okay. Also, the red blood cells will become glycated over time, and that also decreases their flexibility, their deformability. Normally, of the blood cells, over 99% are red blood cells. There's not that many white blood cells. Okay. Here's rouleau formation. That's just a French word for a stack of coins. And again, when you got rouleau formation, you're pushing like a submarine sandwich through the capillaries rather than individual red blood cells. Normal blood flow is laminar, which just means parabolic blood velocity profile. It's fastest in the center. Then that's the red blood cells. The blue right next to it is the white blood cells, just to the side of that. And then on the far lateral, above and below, is the plasma, which is just a fluid containing the plasma proteins. And again, you got a lot of albumin there, with albumin with a negative charge in there. That's how blood normally flows, and that's how you want it to be. The endothelial cells, which line your arteries, have like little cilia-like projections that can sense the direction of blood flow. And these cells are spindle in shape, and they're orientated along the long axis in the direction of flow. And when blood flow is normal and laminar, they're happy. They just keep on releasing nitric oxide vasodilator, and everything is good. Everything is copacetic. They are happy. And this is just a little bit more detail about an endothelial cell. It releases nitric oxide. It's a gas, diffuses into the lumen of the artery, and it interacts with the platelets to prevent them from being activated, prevent them from clotting. It's the most important thing the endothelial cell does is make nitric oxide. The nitric oxide gas also diffuses into the smooth muscle cells on the wall of the artery, and it keeps them dilated. So everything is good. You also got heparin sulfates on there, antithrombin 3, etc. There's more detail, but that's the key point. Okay, so blood is a non-Newtonian fluid. A Newtonian fluid is something like water. It's the same when it's moving. It's the same when it is stationary. Blood is not. When blood is stationary, even when blood flow slows down, it starts to aggregate, okay? That's an important point to know. And low velocity is also called low shear. So here's a typical artery at a bifurcation. The blood is coming up in a laminar parabolic velocity profile, normal blood velocity profile. It's laminar. And then it hits the median divider. It's going to bounce off this, and there's going to be turbulent flow and some retrograde flow, eddy currents. The other thing you'll notice is that you get a deformity of the parabolic laminar curve flow, and you get slower flow, especially along this far wall. And this is right where you tend to form clots, on the far wall over here and on the far wall over here. So this would be like characteristic of the internal carotid artery. So you'll form little atherosclerotic plaque, clots, right in this location. I look at these things all the time. I've looked at many thousands of them, and this is exactly what happens. This is what I meant by that. Once I read Dr. Sloop's book, all of a sudden I could make sense out of tons of findings on CT angiograms, catheter angiograms, magnetic resonance arteriograms. I didn't have a way to make sense out of it before, but after I read Sloop's book, it all made sense to me. So it was very helpful in my understanding of atherosclerosis. Okay, so low velocity flow, like we talked about, a non-Newtonian fluid, blood will start to aggregate, start to clot. High velocity fluid, it damages the arterial surface, and when it damages the arterial surface, then that's going to lead to a loss of the normal antithrombotic endothelial properties, causing plaque, clot and plaque to form in those areas as well. But especially on the far side wall, away from the median divider, that's where you get slow flow and you get atherosclerotic plaque formation. So here's what it looks like in real life. Blood flows, well, not real life, this is my drawing of what real life happens. Laminar flow comes up, let's say in the carotid artery. So this would be common carotid artery in the neck, bounces against the median divider between the external carotid artery, that goes up to the face. ICA, internal carotid artery, goes up to the brain. And when it bounces off of there, it bounces backward, and then you get a lot of turbulent flow, and you also get these retrograde eddy currents. This is slow retrograde eddy currents. An excessive amount of these things confuses the arterial lining cells in this location, endothelial cells, and they start to release their antithrombotic glycocalyx. They shed it into the blood, and then their prothrombotic adhesion molecules below that are now exposed, and you'll form a clot right there. I see this all the time on carotid arteries. And the same thing's happening at the bifurcations in the coronaries, where there's lots and lots more bifurcations. Common carotid artery has only one bifurcation in the neck. Okay, but coronaries have tons of little bifurcations. And this is where you form clots, right at these bifurcations. Now, the body goes into a steady state trying to clear this clot and then it getting removed. So getting hypertension under control will help to prevent this clot because you get less of these retrograde eddy currents. Reducing your dietary lipid will help to remove this clot because you want the body to try to reabsorb it. The sooner the better. The more organized the clot and fibrotic and scar-like, the less likely you're ever going to reabsorb it. You can restore endothelial function in the remaining relatively normal cells. So you can partially reverse an atherosclerotic plaque. Of course, the best way to do that is a low-fat vegan diet. It's the only thing shown to reverse atherosclerosis. The best example is Dr. Caldwell-Esselstyn, but other people had shown that too. Walter Kempner showed it with reversal of EKG findings. Nathan Pritikin showed it with reversal of EKG findings. Dr. McDougall also showed that in his clinical practice. Dean Ornish did a randomized controlled trial showing the same thing, and Dr. Caldwell-Esselstyn has had many patients prevent and reverse heart disease with his low-fat vegan diet with no oil. So again, it is partially reversible. You can reverse and reabsorb the necrotic core. You can reabsorb the lipid core within an atherosclerotic plaque. You can reabsorb the acute part of the clot. You're probably not going to reabsorb the calcification, even though some people say you can. I just haven't seen that. And you're not going to reabsorb the acellular fibrous tissue. If there's still cells in it, you might partially reabsorb it. You get these things called EPCs, endothelial precursor cells, that circulate in the blood, and when a clot forms, they can cover it up, and that's how it becomes subendothelial. Okay, that's going to have other relevance. We'll talk about those endothelial circulating precursor cells in just a moment. So here's endothelial progenitor cells, same thing as precursor cells. They can repair a damaged endothelium. They can also be used for ingrowth of a blood vessel, but you need to know they float around, and there's even a stem cell component to them that they can form like a fibroblast, and that can also contribute to the production of fibrous tissue within an atherosclerotic plaque. So here's just one other paper showing circulating hematopoietic cells. You have them in the blood, and they can form what are called myofibroblasts. Okay, so they're part of wound healing, and they're also part of organizing hematoma or atherosclerotic plaque, being a blood clot, okay, that it organizes, which means the immune system tries to clear it out. Okay, here's an atherosclerotic plaque and a Dacron graft, a prosthetic graft like in a dialysis shunt, and Dr. Sloop wrote papers about this. The point was, how can you form an atherosclerotic plaque in a prosthetic graft if the other theories of atherosclerosis are correct, that it's due to the intrinsic properties of the blood vessel? And what Sloop says, it doesn't matter. You just form a clot in the graft because of the high velocity flow, because a dialysis shunt is from an arterial to a venous system, so you get really fast flow. And then what ends up happening, you get endothelial precursor cells covered up, and they form a neointima on top of it. Okay, that's how you can form an atherosclerotic plaque. And then the immune system comes in and grows into it, and it sort of becomes an organized hematoma in a sense. So that's how you can form an atherosclerotic plaque in a graft. So Sloop wrote papers about that. He then talked about what are other risk factors for atherosclerosis. Basically anything that makes the blood thicker, okay, because that's increasing blood viscosity, and increased blood viscosity is going to increase the blood pressure, going to increase the retrograde and eddy currents and chaotic flow at bifurcations, and that's going to cause more atherosclerosis. Okay, you see how this all makes sense? Fat person's got a bigger body, and they also release lipids into the blood, so they get hyperlipidemia. Okay, if they got high fibrinogen clotting protein, they're going to have thicker blood. Men in general tend to have it. If you take the spleen out, you don't remove red blood cells as effectively, and so you'll have more abnormal, non-deformable red blood cells floating around. Okay, with nephrotic syndrome, you're predisposed to clotting. There's a couple of reasons for that. We're not going to go into that right now. Anyways, The point is he gave you a way to make sense of atherosclerosis risk factors, anything that predisposes the blood to clotting. You take the spleen out, you can't clear your red blood cells out as effectively normal. They're cleared out by 120 days. If you can't do that, then you'll have more, less deformable red blood cells. Okay, here's a therapeutic phlebotomy. And this is what Sloop would do for himself. He would have blood draws like about every 4 months or so, 3 to 4 months, to keep his hematocrit lower. Okay. And then the question is, why did he die so young? Because he's kind of young. He's only 62 years of age. I'll tell you why he died. He had terrible pulmonary disease. He was on, home oxygen, okay? He had severe pulmonary disease. I'm not going to go into the medical reason for it, but he had severe pulmonary disease. Like I said, he was on oxygen, okay? You don't go on home oxygen unless you have end-stage lung disease. And he wasn't a smoker. It's just a different type of disease that he had. The Finland study, they did blood donations, and they dramatically lowered the incidence of myocardial infarction. In this one population group, the incidence of myocardial infarctions in the study time period was, less than 1% in the blood donors, and it was over 12% in the ones who didn't donate blood. So it made a big difference. So he did that. I was always trying to get him to eat a vegan diet, and he said he was looking into it, and he's working on it, but he didn't want to talk about it that much with me. And like all doctors, even though the guy was a genius, he didn't know anything about nutrition, and I think that limited his understanding of a lot of things. But he did have a sense that fat was bad, because he knew that elevated cholesterol comes from high-fat diets, and that leads to elevated LDL cholesterol, elevated chylomicrons, and those are bridging molecules to stick red blood cells together. So he knew that, and he was trying to get his lipids down, but he didn't quite go whole hog with the vegan diet. And I only knew him for a couple of years briefly because we were conversing over atherosclerosis. He was a great guy. He was super nice. He was really funny. The guy's a genius, okay? And he's the guy who figured out atherosclerosis. Like, holy shit, that's about as big a thing as you could figure out. And he was very clever, very articulate. Man was his heart in the right place. He's always trying to do good things, do the right thing. And he was a devout Christian. He was a great man. And the guy deserves a Nobel Prize. I'll never give it to him, but he deserves it. And anyways, it's good for you to learn about him, and I will do my best to try to help keep his legacy alive, and because it deserves to be. And anyway, so rest in peace. God be with you, Dr. Sloop.